Hi, this is Rayanne Lee, and today I'm doing the OTA 227 case study. And my question for this case study was, in older adults with COPD, does energy conservation techniques and education increase independent engagement in everyday occupations? So to start off, I've got some client information here. He is a 78-year-old male, and the prior living arrangement to what he is at now, he lived at home by himself, and he was independent in self-care and household activities. Some medical diagnosis here. He did have hypertensive heart disease with heart failure, which put him in the hospital. He's got COPD and a personal history of malignant neoplasm of liver. The treatment diagnosis was just generalized muscle weakness, and then some environmental factors for him. He will have limited assistance from his brother and sister-in-law. And some more client information. His reason for referral, he did have functional decline. His decline in ADLs of dressing and self-care due to his recent hospitalization and inactivity. He has a decrease in self-care and ADL ability for the past 2 to 3 weeks, resulting in decreased safety and increased need for assistance, which is why he's in therapy. The therapy necessity, therapy was necessary for his ADLs, balance, strengthening, and functional mobility. And he is hard of hearing and is a fall risk. So some findings that were done from assessments during his evaluation. The Barthel Index score, he did have 5 out of 20. The Allen Cognitive Level score was a 3.2 to 3.4. His current level of ADLs with toileting was a max assist, and then upper and lower body dressing was a mod assist. And then current level of balance, his sitting balance was a fair minus dynamic, and then his standing balance was a poor. And then he is a high fall risk. And discharge plans were unknown at the time of the evaluation, but he is a current resident at a skilled nursing facility. Some OT goals that were made for him, the short-term goals in self-care, starting with dressing, was to utilize a no-assistive device to fasten clothing, obviously to increase independence while sitting. And then for dressing his upper and lower body, again, no assistive device to don and doff clothing to increase independence. And then for his grooming, to brush and comb hair, increasing independence. For his sitting balance, the goal here is to increase his sitting balance to a good or fair plus. And then his general strength was to improve to a 4 plus or 5. And then for transfers, to perform transfers with standby assist or just touching assistance. And then the long-term goals are for dressing his upper and lower body. And this is to safely don and doff upper and lower body clothing with no assistive device requiring his independence. So now we have the summary of the 5 articles that were researched for this study. And the first one here is titled Study of Energy Expenditure During Activities of Daily Living, Using and Not Using Body Position Recommended by Energy Conservation Techniques in Patients with COPD. So obviously here the population study were patients with COPD. The type of study here is just case control. It's just comparing the odds of actually using the energy conservation techniques during occupations versus not using the energy conservation techniques. The intervention tested was energy conservation techniques during ADLs. Relevant findings for this study, the COPD patients should be taught these techniques in energy conservation in order to accomplish their everyday activities. Using these energy conservation techniques actually helps maintain their functionality while doing these and breaks the cycle of inactivity. That was a big thing for this article, was just breaking that cycle of just because you are a patient with COPD doesn't mean you need to stop doing the everyday things that you need or want. The next article was titled, Does Education in Energy Conservation Improve Function in People with Chronic Obstructive Pulmonary Disease? So again, patients with COPD were studied, and with this study, they just combined data from different research study to make this article. And the type of interventions that were studied was education, pulmonary rehabilitation, energy conservation, and energy expenditure. The relevant findings from this, there with this one, there was limited evidence for the effectiveness of education in the energy conservation techniques alone. So actually demonstrating these energy conservation techniques in an actual setting where they would be using these techniques in their daily occupations was more effective than just educating them on, you should do this or that, but actually showing them in a real life situation where they would be able to show them how to do these energy conservation techniques. That was more successful than just education alone. And then for the next one, we've got the title was Pulmonary Rehabilitation and COPD, Providing Patients a Good Environment for Optimizing Therapy. So here, COPD patients were studied of all stages, and then this was just several randomized studies, and it aimed to highlight the impact of pulmonary rehabilitation on COPD patients. And then in this pulmonary rehabilitation study, it included exercise training, education, energy conservation, and nutritional interventions. The relevant findings and implications of this study was shown that successful pulmonary rehabilitation demonstrated to provide beneficial effects on dyspnea. So dyspnea was decreased during the study while using all these techniques. Their muscle strength and endurance was increased, as well as their self-management and education, and then also their energy conservation techniques. So successful pulmonary rehabilitation, which contains all of these things, was successful in the patient's everyday occupations. The next one, we have improving dyspnea management in 3 adults with COPD. So this one, obviously 3 adults were studied that had COPD, which were in an outpatient center at a large urban hospital. This is a case report. So all 3 of these patients went through OT intervention 5 or 6 times a week for 1-hour OT sessions. And these interventions focused on energy conservation and dyspnea control reduction during the activities that they did during the sessions. And the outcome of this study, all 3 patients documented improvements in performance after the OT intervention, combined with their exercise training, as evidenced by the outcome score for this article, and then also their self-report stating that they had more life satisfaction and improvement during their everyday occupations. And then the last one is titled Chronic Obstructive Pulmonary Disease and Engagement in Occupation. And here again, there were 3 participants that were studied that had COPD. And with this one, they just constructed semi-structured interviews with each patient. And the intervention tested in the study OT intervention for COPD patients as related to their engagement in meaningful occupations. And the relevant findings here, the OT intervention that was embedded within the pulmonary rehabilitation program, it facilitated a positive engaged life pattern. So the findings from the findings from each structured interview with all 3 patients shown that using pulmonary rehabilitation and energy conservation embedded into that actually improved their engagement in occupations. Okay, so for this first therapy session, what we would do for the first 30 minutes is, or for the full 30 minutes that we have, we'd work on upper and lower body dressing and donning socks and shoes while sitting on the bed. That's a really important technique, is to sit while doing your dressing. And then after we did that, we would transfer from the bed to the bathroom sink to groom the patient's hair and then brush his teeth. And at this point, if the patient does become fatigued, he can prop his elbows up on the counter, which is another good technique to use. And then if that was too much, he could always sit while doing his grooming. So doing that focuses on his dressing, grooming, and transfer goals. If any of these things is too difficult, you could have the patient start out using adaptive equipment just to help him get dressed. Now, the long-term dressing goal is to use no adaptive equipment, so obviously we'd have to wean the patient off of that and show him that you know, he can be independent without those things, but just starting out, if he needed them, that could be something to do if it was too difficult. And then if it was too easy, maybe let the patient try donning his upper body standing. And then the second therapy session, for the first 15 minutes, we would do ring the ball in the basket activity, which is where the patient would just be sitting in a chair or his wheelchair, and you'd have a basket about 6 feet in front of him, and then you'd have a basket next to him on a table that had about 20 to 30 tennis balls. And so you could time the patient, and what he would do is he would just take one ball at a time and try to ring it in the basket in front of him. So this activity works on dynamic sitting balance goal, and I think it's just a fun activity to get away from all the exercising and stuff like that. So it's just something fun to do. But if this was too difficult, you could have the patient move the basket closer, or maybe take away the amount of tennis balls, maybe not have so many. And if it was too easy, you could move the basket farther away, maybe add the amount of tennis balls, or maybe do some weighted balls, or put some weights on the wrist to make it more difficult. And then the next 15 minutes, we would work on fastening. So we would have the patient don and doff a button-up shirt. So he would put the shirt on, button it up, and then unbutton it and take it off. And then once he takes it off, we would actually have the patient take the shirt and pin it up on a clothesline while he's still sitting. So you'd have the clothesline in reaching distance and about shoulder level, so he can hang the shirt up on the clothesline. And this, again, focuses on the upper body dressing, fastening, and then the dynamic sitting balance goals again. And then if this would be too difficult for the patient, you could move to a shirt that had larger buttons that were easier to don and doff. And then maybe if hanging them up on the clothesline was too difficult, have him just fold the clothes and place them in a basket beside him instead. And then if it was too easy, maybe move to a shirt that had smaller buttons that were more difficult to don and doff. And then if we wanted to, if the putting the clothes up on the clothesline was easy for him, maybe raising the clothesline higher and then getting him to actually stand up and take the shirt and pin them up on the clothesline. And then for the last therapy session, for the first 10 minutes, here we would just do some light upper body exercises, maybe getting the TheraBand out and using it. This focuses on that short-term strengthening goal. And if this was too difficult for him with that TheraBand, there are different types of TheraBands, so you could move to one that wasn't as tight, or just maybe a weighted stick with no weights on it. So that might be a little bit easier for him to control. And then if the TheraBand was too easy, you could move to a weighted stick where you add weights to it. So you could add, 1 pound or 2 pounds or however many that he can control. The next 20 minutes for this therapy session, we would actually transfer from his wheelchair to the therapy kitchen to wash and dry dishes and put them up on the lower level cabinet. So here we would just have the patient clean and dry all the dishes. It works on the transfer goal as well as standing balance. And if this is too difficult, maybe only wash 1 or 2 dishes. And then if it's too easy, maybe wash multiple dishes and dry them. And then instead of just putting it up on the lower level cabinet, or it's an upper cabinet, but the first level, instead of putting it just on the first level, maybe you can try the first and the second. So he actually has to reach more, use those techniques to get those bowls and plates up on a next level. So that would be something that would be more difficult. And then for the home program, just some things that would be really good for him utilizing these energy conservation techniques is to organize closets, drawers, and shelves. And with this, you would just place the items that the patient uses the most at the mid-levels, at shoulder level, so he doesn't have to reach too high up to put things away or to get things down, and then he doesn't have to bend too far down to grab things either. And then just planning out activities, making time for breaks, and then also planning out, the hardest thing that I've got to do today, do it after breakfast in the morning when I have the most energy. And then sitting during ADLs and IADLs, that's just something simple to save energy. And then the last thing is to get a patient a rolling cart, and this just reduces the amount of strain on the body, having to go back and forth, using multiple trips to get things, like if he's cooking, having to go to the cabinets, grab one thing, come back, grab another. You just put everything on one cart and then roll it to the kitchen, and you've got everything you need right there. So those are just some good things to utilize at home once the patient is discharged. And that is the end of my case study. Thank you.